Dr. M. Srinivasan, member Niti Aayog, our respected chairman, dignitaries in the audience, my colleague at work, Sangeeta, and Sunita, many other senior doctors who are attending today's function, dear members of the Apollo family. And when I say Apollo family, I'm actually talking about almost 200,000 people who have come together in multi-locations for this initiative with a single-minded agenda to just serve the people of our nation and to set a standard and a benchmark throughout the globe. And I think that is what has made today significant and it has made today special. After all, healthcare it's about caring, it's about focusing. And I think every milestone we reach, every step we move in the right direction is in that single-pointed agenda of doing whatever we can to raise the bar on the delivery of healthcare. Always open, always here is a global first. It was conceived by our chairman, it was thought through by our chairman, who in his earlier days said that the emergency room should never be, it used to be called a casualty room, and he said it should never be a casualty, it should be an emergency room. Healthcare has to be able to reach every individual who needs it. So Apollo Hospital was born from that dream. What can we do to serve the public better? There was telemedicine, many other initiatives. But today's initiative is far more far-reaching than all that we've done over these years. And it truly is a global first, because nowhere in the world do people commit to the fact that all services will be open on a Sunday. All services will be available to people on a Sunday. And you may ask us, saying, anyway, they're the emergency rooms. But it's precisely why we don't want an emergency that always open, always here is being launched today by our chairman. It will have all services available to people. It will have the emergencies available, but anything which they need, which they don't have to wait for, a week slot, will come over the weekends and especially on Sundays. And this is significant because in today's world, there are busy executives working 24/7, and they really wonder, how will I take my aging parents? How will I take my child to the pediatrician? How will my wife really get that consult which she needs unless I take off from work? And that becomes a reason to push things further and further till there are emergencies. And for this precise reason, we're saying that please don't wait, because events don't wait for anyone. Your health is your most important asset. We are there to serve you, and that is why we are available. We're always open. We're always there to serve you. But what is delightful is today, the entire Apollo system, which is 80 plus locations, multiple pharmacies, clinics are listening to what we're saying. So we will start by keeping the hospitals available on Sunday for routine work so that people don't have to wait. We will start by saying that we encourage you to take your preventive checkups. Don't wait for the weekdays and taking time off from work. We're there on a Sunday. Come as a family and prevent the onset of disease. We're available for you anytime if you want to call us in need. So I think this is what Apollo commits to, and it is probably one of the most significant announcements, launches, pledge by the entire Apollo family to raise the bar, to push ourselves further to deliver what we have to do. So I really want to thank the members of the media who've supported us in our journey for over 42 years. And today, all of you have been there to let people know that, healthcare is available to them. They don't have to wait. They don't have to hesitate. And of course, I have to thank our chairman because he doesn't stop pushing us. And there was somebody who said that he doesn't know English because he doesn't know the meaning of the word no or not possible. So thank you, Chairman. The entire Apollo family of over 200,000 people are committed to this vision and to this dream. And to our friends who are there, thank you for your support and for being there. Namaste and Jai Hind.
Every huge step forward at Apollo hospitals comes with the willingness to look at a problem with a fresh set of eyes. We recognize that healthcare needs to be available on Sundays and cannot follow the traditional work week. Having recognized this, it was not just a vision, it was something that we wanted to make functional, and we did so by restructuring the organization so that everyone, whether it's a diagnostic facility, a doctor you need to see, an operating theatre, the emergency, were available for you, because healthcare doesn't move on 6-day-week time frame. Why do we do so? Because we recognize the cost of a delay. We recognize the cost of not picking up a disease when it has already started in your system. It's because we value life and we recognize that time is of the essence, especially with preventive health checkups. As we take this forward, as we integrate it across the organization, whether it's through 24/7, our call centers, our diagnostic facilities, our ambulances and our hospital, we do so with the willingness to make sure that you have healthcare available at your doorstep. More importantly, recognizing that healthcare has to be in harmony with human life. So Apollo is there for you, it's there for you every day of the week. We're always open, we're always there, because your life is very precious.
Thank you. Good evening to all of you. Namaskaram. I think the Apollo family, the family will understand Namaskaram better than anybody else. Respected Dr. Pratap Reddy Garu, Dr. Sangeeta Reddy Garu, Dr. Sibal, all the medical doctors here, the various people, the who is who of the India is here. You look into the people here, ambassadors, healthcare providers, ambassadors, entrepreneurship, everything is here in this August gathering at the moment. First of all, I should say that thank you, Dr. Pratap Reddy Garu, because you said the government has done a lot. And I take it as a compliment, and the greetings from the Niti Aayog for that. And we all know that, that no more we are thinking from the Niti Aayog point of view, from the Government of India point of view. We are not looking at healthcare as just a treatment. The entire spectrum is now with the things. It starts from the prevention. You go to the lowest of the last mile institutions which we have. The prevention is something which we have taken most important thing for us. And then comes the health promotion. What we are seeing today. The casual nature has been removed by the chairman. I think give a big hand to him that he has removed the casual nature in the hospital, not the casualty, in addition to what he has done. So somewhere the health promotion going on to the early diagnosis. That's where the initiative, what is being told today. And of course, the treatment everybody remembers, rehabilitation everybody remembers, and the palliative care is something, the geriatric care is something which is being added up. The entire spectrum of the thing, right from the prevention to the palliative care is something which the government institutions are doing and the private institutions are complementing with that. And I'm very happy that the chairman sir said that the government of India has done enough and very much. And then I'm happy to share with you the flagship program of what has come from us is the PMJ, the Ayushman Bharat scheme. Today the person who can't afford, he has the card and then the trust and the belief that if something goes wrong, there is a possibility of not only in the government hospitals but also in the accredited and empaneled private hospitals of the country. That's something which is visible to most of the people. Now, what is not visible to most of the people, except the doctors, is something, the Ayushman Bharat digital mission. And today we have more than 90 crores of our people on the ABBA, Ayushman Bharat health account, which is a unique ID. It's like an Aadhaar for the medical ID, the unique ID which we have created. We are working, and the process is already on, getting the data on board, the structured data on board, interoperability and handshaking with all the APIs and the various others, so that we will have the electronic health records also come to the epidemic platform. Having done that, then you go to the smallest of the Ayushman Arogya Mandir, which we talked about. Today we have almost more than 1.8 lakh Ayushman Arogya Mandirs in the country, and everything is taken care. The taking care of the looking forward for the health checkups, including the hypertension, diabetes, common cancers, everything. All that is being taken care on that. Added to that, we have another component under the Labour Ministry. I was at ESIC Hospital at Hyderabad. Now today, under the ESIC, which almost comes to the level of 15 crores population of the country, if you look into all the family members of the insured persons, so after the 40 years of age, mandatory health care has been taken, health checkup has been taken up now. So that's a preventive component which is being taken up, and that's where we see today the synergy and the complementary nature of the government initiatives and the private institutions which are visible now. This is a great initiative, so we will definitely complement with each other. And I talk about my own, Chairman sir told about the Sunday being the working day for the routine health checkups in the hospitals. I'll just give my own example. Being a pediatric surgeon, our mothers will come and say that, Saturday should be a full day for us. Saturday operation theatre was full time. I used to run the Saturday full time operation theatres because we know that, the daycare surgery for the school children is good to do on a Saturday, and then they have a Sunday off. The mothers can afford to be with the baby and the child on a Sunday full day. So that's something which I wanted to. Second thing is, again, we have these academic holidays in the medical institutions. And again, we used to work more in the summer holidays. And because the schools are closed, the babies and the children are fine to have a surgery, the elective surgeries in the All India Institute of Medical Sciences, New Delhi. That's something which I would like to bring to the attention of the chairman, sir, that, some Saturday and the summer holidays were also the best days for us because we will give the maximum treatment and the comfort of the mother and the child in the things. So let me again congratulate Dr. Pratap Reddy and the Apollo family and the extended family. There's a difference between the two. You're part of the extended family. So for having got this initiative, a wonderful initiative, which will put this, remove that casual nature and walk into on a Sunday for the preventive health checkup also. And this aligns with the India's ethos, the government of India's, that we need to focus more on the preventive health care. And then we are there. Let us complement each other, the government institutions and the efforts, the private institutions and the efforts, and then put onto this and then go beyond that. Today we are talking about the preventive health. I think we need to add a little bit more to that holistic nature. Can we add yoga? Can we add meditation to the preventive health checkups? So that's something which I request the chairman, sir, to take it up. They're already on there. They have a flagship program, I'll wait in that. And then let us complement each other, let us work together so that the government institutions and the private institutions come together and then come to the level of not only building up Viksit Bharat 2047, but a very healthy, robust population for the Viksit Bharat 2047. Thank you very much.